You're watching a comprehensive prolotherapy treatment to the shoulder. My name is Danielle Stylen, and I'm a physician assistant at Caring Medical, and I'm the one performing the procedure in the video. So right now, I'm injecting solution into the posterior structures of the shoulder, the posterior joint capsule, insertions of the rotator cuff, and I'm going to move on and do the AC joint and the insertions on the superior shoulder. So as you can see, prolotherapy, it's a lot of injections, a lot of shots into the tissue. It is very comprehensive. So in the shoulder treatment, I do treat all aspects of the shoulder, all the ligament and tendon insertions to make sure I cover the whole ground. I should point out that this patient is not sedated in any way. Most patients don't need any kind of sedation to get through the treatment. It is relatively quick, and patients tend to handle it very well. If they do need some kind of sedation or they have, fear of needles or anything like that, they can take pre-meds ahead of time before the procedure, or we do some IV sedation in some cases. But this patient is doing just fine. Again, I'm making sure I get all aspects of the posterior shoulder and the AC joint with the patient sitting up. Once I'm done with this, I will have the patient lie down to do the front of the shoulder. That's more comfortable for the patient, more comfortable for me to make sure I get all those insertions as well. So this patient in particular came to see us for repeated shoulder dislocation. So he had a history of dislocating his shoulder a lot and came to see us. He had MRI findings of multiple labral tears, some rotator cuff problems as well, and just overall joint instability of the shoulder. As you can imagine, from multiple dislocations, the ligaments weren't holding everything together the way they should. Oh, so here he is. He's laying down. I'm doing the front of the shoulder, making sure I do get those rotator cuff insertions and the anterior joint capsule as well, as long as the glenohumeral ligaments. So back to the patient, like I said, multiple shoulder dislocations. He's been seeing us, doing really well. I do comprehensive dextrose prolotherapy to all the surrounding structures. And then you'll see in a minute that I'm actually going to use PRP, or platelet-rich plasma, also in the front of the shoulder. Now, platelet-rich plasma is actually a form of cellular prolotherapy where we take concentrate cells and platelets from the patient's blood and inject that back into the joint. It's a more aggressive form of prolotherapy, and we typically use it for someone that has had a labral tear, such as this patient, or other intra-articular joint pathology, like osteoarthritis, or other cartilage lesions and so forth. So as I was saying, the PRP, we're going to inject it actually into the joint and some of the surrounding ligaments. There it is right there. That's the PRP, platelet-rich plasma. And it works really well, and patients tolerate it really well. Most of it does go inside the joint, and then the remainder of it goes, wherever the patient has the most pain. So in this case, it was in his anterior shoulder, those attachments.